Well, good afternoon. I'm sorry, I don't have any videos like that. You know, this has really been quite an exciting morning. It's great to see so many people here who realize the importance of combining all of these different approaches to behavior change to working to build a healthier nation. You know, we have a lot of challenges. We spend far more than any other industrialized nation in this world. So spending that much money on health care would be okay if the results were good. But what are those health outcomes? When we do a comparison of our life expectancy in this country and compare it to other OECD nations, we find that we compare poorly. This impact of poor outcomes associated with high costs affects the lives of everyone in our country, the strength of our economy, and it affects our national security. 71% of those 17 to 24 are ineligible for military service, and health is a factor in over half of them. And the health factor that is the largest is obesity. We have an epidemic of obesity. We think about Colorado today. Colorado is the state with the lowest rate of obesity in the nation. But Colorado's rate of obesity today is higher than Mississippi's was in 1990, when Mississippi was the worst state in the nation. So why are we so unhealthy? It's because of the way that we live. Just look at the comparison of what's been happening over the last few decades. We've gone to increase the number of calories by 20%. We're eating fewer vegetables and far more fats and oils. And then when you look at comparison of how it has affected our health, we look to the National Health Examination Survey. The number of people who 3 decades ago reported excellent health was 32%. Most recently, it's dropped to 13%. Those who report no regular physical activity was 17% in the 80s and early 90s, and now it's more than half. How do we change that? You know, Albert Einstein said, we can't solve problems by using the same kind of thinking we used when we created them. So let's think about what culture is. Culture is a learned and shared behavior of a community of interacting human beings. It's the way we live. It's our shared values. So it's our culture as a nation that leads us to be unhealthy. So for our nation to be healthier, we need to change our culture. That is why we at the Robert Wood Johnson Foundation have adopted a new vision, that we as a nation will strive together to build a culture of health, enabling all of us in our diverse society to lead healthier lives now and for generations to come. What does a culture of health mean? A culture of health means being healthy and staying healthy is an esteemed social value. That the health of the population guides public and private decision-making. That geography and demographics do not serve as barriers to good health. And that individuals, businesses, and governments work collectively to foster healthy communities and lifestyles. And that the economy is less burdened by the cost of health care and unwarranted spending. So if we are all going to be healthier, we all need to be supported to make proactive choices that will improve our health. That health becomes a default choice because it's the easy choice. You know, a number of you have come from many states around the country, and you've flown through the airport. Have you ever tried to find a healthy meal at an airport? Health is not the easy choice in those cases. So with all of these challenges, why do we believe that we can be successful in making a cultural change, because cultural change is so hard. We believe it because we've done it before. 50 years ago, we had a different culture. If we were in this room 50 years ago, there would be ashtrays by each of the chairs, and it would be full of smoke. 50 years ago, learning to smoke was a rite of passage to adulthood, and smoking on airplanes was the norm. In 1964, at the Democratic Convention in Atlantic City, it was the classic smoke-filled room. That's not a bad photograph. That's smoke wafting up to the rafters. But over the last generations, the norm has changed. And policy change has been interwoven with changes in behavior and outreach into communities. But how do we get there? How do we get to this point of change? Well, let's look at the rate of smoking. You know, it's interesting that perhaps the biggest rise of smoking began at the beginning of World War II, when the K rations and the C rations included cigarettes as part of that. And the GIs who went to fight in Pacific and in Europe came back addicted to tobacco, to the point where in 1964, when we saw the Democratic Convention in Atlantic City, and then the Surgeon General, Luther Terry, issued his report on smoking and health. This landmark report led to policy changes, and tobacco advertising was banned on television, and the federal cigarette tobacco tax was doubled. And we began the long decline in tobacco use that we see today, a decline that only continues because of the hard work of many of the people in this room and people like you across this nation who have not given up on tobacco, who understand that we still need to make these cultural changes. So how do we measure? So these cultural changes have also shifted in the way that the private sector has operated. Most recently, we've seen CVS, who has taken tobacco products out of their stores because it doesn't fit with their mission, and at the same time, they've seen no change in their bottom line. To address how we build a culture of health, we've developed an action framework. We recognize that we need to make health a shared value, that we have to foster cross-sector collaboration, that we have to strengthen the integration of health systems and create healthier and more equitable communities. And that we realize in each of these areas there are certain drivers for change that can be measured, changing mindsets and expectations, a sense of community and civic engagement. What does that look like? Well, in Brownsville, Texas, and for those of you who don't know, that's way down at the end of the panhandle in Texas, or the base of Texas, or whatever they call that piece down there. About 200 organizations got together because they looked at their health data. They realized that they had high rates of heart disease, of diabetes and stroke and obesity. And for them, these health statistics were a revelation. So they got together because they had a common value for health. And one of the things they did was to create the Bike Barn, which repaired donated bicycles and then made them available free of charge to people in the community if they gave 25 hours of community service. And then they closed off the main street on the weekends to encourage people to walk and to ride and to stroll. And what happened? People came. And the businesses on Main Street were concerned. What they found out was the revenues actually went up. They created this out of a shared value of health. The next area is to foster cross-sector collaboration, where the drivers are the number and quality of the partnerships, the investments in cross-sector collaboration, and policies that support collaboration. This is one where we really have to start thinking differently, because we will only succeed if we take chances and consider completely new approaches and ways of thinking. We have to move from the medical model and understand where people live their lives and where their health is. When you look at Department of Labor statistics, people spend 23% of their time working, 18% of their time watching TV, a little bit more during the Super Bowl, 5% of their time eating and drinking, 3% shopping, 1.3% exercising and sports, and just 0.1% in clinical settings. We realize that health happens where we live, learn, work, and play. And understanding that and looking at it that way, we realize that new issues emerge and new partnerships have to be formed. The Robert Wood Johnson Foundation is based in Princeton, New Jersey. During the last legislative session, there was a measure to mandate universal pre-K. And at the legislative hearing, a teacher, a veteran kindergarten teacher from Freehold, New Jersey, her name was Randy Mattlebaum, took the legislature to school. And what she did is she just showed some pictures. Looking at this picture on your left, you see a child who didn't have preschool. And on the right is a drawing from a child who did. On the left, a child who didn't have preschool talking about his alphabets and trying to draw them. On the right, a child who had preschool. And for numbers, the child on the left who didn't have preschool could only count to 5 and couldn't write numbers. The child on the right who did have preschool was able to count to 20 and with pretty clear numbers. I wish my writing was so clear. Children who attend Head Start and pre-K also, in addition to having better school skills, also have better social and emotional development. And that's important because we've recently funded a study that looked at, over a period of 17 years, what happens to children interschool with better social emotional development. What do they look like when they're into their 20s? We find that they're 4 times more likely to graduate from college. So maybe by now you're starting to scratch your head and saying, this really isn't about education. Isn't this a health conference? Well, when you look at the data and you look at somebody who is 25 years old, those who haven't finished high school have a 9-year shorter life expectancy than someone who has graduated from college. Those with better social emotional development, developed skills are less likely to smoke and less likely to use illicit substances. So as we start talking about the broader concept of health and role that many sectors play and the policies, the education actually begins to play a role. And we begin to understand that teachers can be as important as pediatricians in the future health of our children. That engaging parents becomes as important as engaging as prenatal child visits. And that we need to engage community leaders and community health workers as well as public health practitioners and clinical providers. The next dimension for culture of health is strengthening the integration of health systems. There, the drivers are access, consumer experience and quality, and balance and integration. So what does this look like? New Brunswick is where our foundation, the Robert Wood Johnson Foundation, started. It was started by Robert Wood Johnson in the 30s, and we became a national foundation in 1972. There are no swimming pools where children had a place to learn to swim in New Brunswick. And it's right on the Raritan River. And headlines like this were all too frequent as children sought a place to cool down in the summer. When the Robert Wood Johnson University Hospital partnered with the New Brunswick Development Corporation to build a fitness center and a grocery store, that was a very important development because it met the need of the hospital to do physical therapy and water therapy. But they also opened it up for local grade school kids to get swimming lessons. Integrating health and healthcare systems to make them more effective and efficient and provide services that improve the community's health is a critical part of improving health and building a culture of health so that our focus shifts from treating disease to preventing it. The last area is creating healthier and more equitable communities. And the drivers for this are the built environment, physical conditions, social and economic development, policy, and governance. Risa Lavizza-Mori is fond to say that the choices you make are determined by the choices you have. And what does that mean? Think about someone who lives in an inner city, where their choices are where they get their food because they live in a food desert, so they go to these kinds of facilities. And the choices inside the store are nowhere near what you would like to make if you were choosing a healthy environment. Well, that is beginning to change with organizations like the Food Trust, led by Yael Lemon in Philadelphia and has expanded across the country, who's begun working with major grocery chains to demonstrate that opening stores in food deserts is not only the right thing to do, but it's also profitable. To make fruits and vegetables available to children throughout the nation and to other folks within the community. And this is a result that enables them to eat healthier. But what about the convenience store? We've also found that by working with the supply chain, you can enable them to sell fruits and vegetables at a reasonable rate. Making health a shared value, fostering cross-sector collaboration to get all players to the table to affect social change, strengthening the integration of health systems with healthcare systems and across the community. All of this involved to create equitable, more healthier communities. Involves the integration of policy change, social marketing, behavior economic approaches, and all the things that are being discussed today. Because if we work that way, we will know that we as a nation will together build a culture of health, enabling all in our diverse society to lead healthier lives now and for generations to come. And if you want more information, you can go to thecultureofhealth.org. We hope you will join our campaign. Thank you.